Hello there, my name is Artur Valerievich and I teach anatomy. And today we're gonna speak about arteries of upper limb, about arteries of arm, forearm and hand. And begin from brachial artery, arteria brachialis. As you remember, axillary artery go down and became brachial artery. On the level here, on this level, it's like the level of inferior margin of pectoralis major muscle. Brachial artery, it's like continuation of axillary artery. It go down on arm in like synovial sheath with nerves and veins, and it go down to fossa cubital, to cubital fossa, where it terminates and divides on ulnar and radial arteries, arteria ulnaris and arteria radialis. So brachial artery, it has some branches, and like you can see here, there are three main of them. First one, it's arteria profunda brachii. Here, it's go backward and it go into canal. You remember, on posterior side of humerus, between humerus and triceps brachii, we have canal, canalis nervo-radialis. This artery goes to this canal, it go along with radial nerve, and there, as you can see, it divides on arteria collateralis radialis, this one, and arteria collateralis media, in the middle, and radial collateral arteries. They go down to elbow joint, like in the region of lateral epicondylus, epicondylus lateralis. Arteria collateralis radialis go to the front of this epicondylus. Arteria collateralis media go backward. After it, brachial artery give two more branches. They are superior and inferior collateral ulnar arteries. So this will be arteria collateralis ulnaris superior, this arteria collateralis ulnaris inferior. They both go to medial epicondylus, epicondylus medialis, also in front or beside it. And that's all about brachial artery. So it goes to cubital fossa and divides on radial and ulnar arteries, arteria radialis and arteria ulnaris. These arteries occupy some grooves on forearm. You remember, we have sulcus antebrachii radialis, sulcus antebrachii ulnaris between muscles. So arteria radialis occupy this radial groove, arteria ulnaris occupy ulnar groove. They go along with some veins with the same name and some nerves. We will study them later. So if we talk about like the beginning of these arteries, we must talk about supplement of elbow joint. First branch of radial artery, like on the level of neck of radius, as you can see, it's arteria recurrent. It's recurrent artery, arteria radialis, recurrence, arteria recurrens radialis. As you can see, it go up and in front of lateral epicondylus of humerus, and it will make anastomose with collateral radial artery. So here is your first anastomose. In front of lateral epicondylus, we have anastomose of arteria collateralis radialis with arteria recurrent radialis. Next, ulnar artery. As you can see in this picture, it can be like two different arteries, or it can be one vessel that then will divide on two branches. Anyway, ulnar artery give two branches. They will have name like anterior recurrent and posterior recurrent ulnar arteries. So it will be arteria recurrens ulnaris anterior. This will be arteria recurrent ulnaris posterior. Arteria recurrens ulnaris anterior, as you can see, it go in front of medial epicondylus and make anastomose with inferior collateral ulnar artery. So here you have your second anastomose. And posterior recurrent artery ulnar make anastomose with superior collateral, with arteria collateralis ulnaris superior, beside medial epicondylus. So here is your second and third anastomosis. And finally, ulnar artery gives this vessel. It's arteria interossea. Interosseous artery that go into interosseous membrane and divides on two vessels, on anterior and posterior interosseous arteries. Arteria interosseous anterior, it's laying on your membrane and will supply these deep muscles of anterior group of forearm. Arteria interosseous posterior here, it go back, it penetrates membrane and laying on posterior surface of membrane, but in the beginning it gives one recurrent branch. It's arteria recurrens interossea here. Arteria recurrent artery that go up beside the lateral epicondylus and make anastomose with arteria collateralis media. With medial collateral artery, it's branch of profunda brachii. So here is your last fourth anastomose. So here is your supplement of elbow joint. You have 8 arteries and 4 anastomose. As I told you previously, brachial artery divides on radial and ulnar arteries. Arteria radialis. If we talk about radial artery, it occupy this groove, radial groove on forearm, and in this inferior part, you may know, in this inferior part near the styloid process of radius, it's covered only by skin and fascia. So in this place, it can be palpable, and you can touch and feel and pressure and heart rate, investigate heart rate in this place. As you can see, radial artery decline to the back. As you can see, it go around first metacarpal bone posteriorly. It go through anatomical snuff box, if you remember what is this. It will penetrate first intermetacarpal space and come back to your palmar side of hand. And it terminate with deep palmar arch, arcus palmaris profundus. I will tell later what is this. If you talk about ulnar artery, it occupy this ulnar groove for forearm. It go through carpal canal. It's laying on the palmar surface of hand, and it will terminate with superficial palmar arch, arcus palmaris superficialis. On the level of wrist joint, arteria radialis will give some branches. First of all, you can see it here. It gives branches to your wrist joint, to your carpal bones. It will called ramus carpalis. On the palmar surface, on palmar side of hand, it will called ramus carpalis palmaris. On the back side, it will called ramus carpalis dorsalis here. Then, on the level of styloid process, it will give superficial palmar branch. It's ramus palmaris superficialis. That will make anastomose with ulnar artery and take part in this superficial palmar arch. Then it will go, when it will loop around the first metacarpal bone, it will give this branch. It's dorsal metacarpal artery, arteria metacarpalis dorsalis pollicis. It will go to first finger, to your thumb, and will supply back side of your thumb. Then, when radial artery will penetrate first metacarpal space, it will give one important artery that is called arteria princeps pollicis. That will divide on, as you can see, maybe 3 vessels. 2 of them it's laying on palmar surface of your thumb and will supply it. One of them go to your index, your second finger, arteria radialis indicis, and it will supply like radial side, radial aspect of your index. And finally, when radial artery come back to the palmar side, and will become deep palmar arch, arcus palmaris profundus. Branches of ulnar artery, I already told you, on the level of elbow joint. Then it will go down, and on the level also of styloid process of ulna, it will give deep palmar branch, ramus palmaris profundus here, that will go under the muscles of your hand and create anastomose with terminal part of radial artery, and this will be deep palmar arch, arcus palmaris profundus. Ulnar artery on the level of wrist joint also give these branches, carpal branches, ramus carpalis palmaris on this side and ramus carpalis dorsalis on back side of hand. We will return to them later. And ulnar artery go further, decline laterally, and create anastomose from superficial palmar branch of radial artery. So here is your arcus palmaris superficialis, superficial palmar arch. As I told you, on the level of your wrist joint, on the carpal bones, on anterior and posterior side of your carpal bones, there will be two networks. So on anterior surface, on palmar surface, on this level, you will have rete carpale palmare, palmar carpal network. So rete carpale palmare, it consists of this palmar carpal branch from ulnar artery. Here is ramus carpalis palmaris. Carpal palmar branch from radial artery here, and interosseous artery. And anterior and posterior arteria interossea come here. This network, it supply all these small joints and these ligaments and muscles there are there. Now you know that on the palmar side of hand we have two arches, arcus palmaris superficialis and arcus palmaris profundus. So what do they give? They give some branches. So if we talk about superficial arch, as you can see, it give these branches. They called arterii digitalis palmaris communis. It's like common digital arteries. Palmar, yeah, of course, it's on palmar side, so palmaris, that come to the level of metacarpophalangeal joints. Arcus palmaris profundus give these arteries that called arteria metacarpalis palmaris. It's metacarpal palmar branches. That also it's laying directly on the interosseous muscles and go along and go also to the head, to the level of heads of metacarpal bones. They join, as you can see, these common digital arteries, they join with these metacarpal palmar arteries, and then each of them divides onto proper digital arteries, arterii digitalis proprii, also palmaris. So these arteries go to adjacent aspects of this finger, but the ulnar aspect of fifth finger of your pinky have also one artery, but it came directly from ulnar artery, as you can see, and it will have name like just arteria digitalis propria palmaris also. Now you know that every of your fingers get two arteries on palmar side. But what about dorsal side? Every finger must have also two arteries on the dorsal side. But where they came from? And here we go back to your rete carpale dorsale, your dorsal carpal net. Again, it's created by dorsal carpal branch from radial artery, dorsal carpal branch of ulnar artery, and also arteria interossea dorsalis came here. And here we have rete carpale dorsale. When we talk about palmar network, I told you that it supply only your carpal bones, joints, and ligaments. But when we talk about rete carpale dorsale, it also supply you carpal bones, ligaments and joints, but not only this. It also, as you can see here, it gives 3 more or even 4 artery metacarpalis dorsalis. It's dorsal metacarpal arteries that go up along with this interosseous dorsalis muscle and on the level of the head of metacarpal bones. It divides on 2 proper digital arteries, arteria digitalis propri dorsalis, also dorsal, and supply adjacent aspects of this finger. Also, a 5th finger, pinky, will have its own proper digital dorsal artery. So this is supplement of your fingers of hand. So each of your finger have 4 arteries, 2 on palmar side and 2 on dorsal side. On palmar side, they came from this common digital arteries from arches. Dorsal came from metacarpal dorsal arteries from retacarpale dorsale. Like exception, it's your thumb, because it have like its arteria princeps pollicis, its own artery on palmar side, and it have like its own metacarpal dorsalis pollicis on the back side. Thank you for your attention. Subscribe, ask me questions, and see you later. Peace.